Hello everyone, I am Dr. Mohammad Nishar.
And I'm Dr. Mradul Gupta. We both are plastic surgeons and we will be discussing about facial fat pad compartments of the face. So Dr. Nishar, can you please tell us about why we should know about facial fat pads?
Yes. So aging is a physiological process in which all components of the face are involved. Most of the people think that during the process of aging, only skin is get involved and it shows wrinkles. But we have to learn about other components which causes the effect of aging. So, Mradul, can you explain about the components involved in aging and how it is located?
Yes, definitely. There are usually four compartments of the face. One is the skin, the muscle, the fat, and the bone. And we should know every compartment of the face because in aging, every compartment of the face is involved whose additive effect is seen on the skin. So if we talk about bone, there will be bone resorption. If we talk about muscle, there will be atrophy of the muscle. If we talk about fat, then the superficial fat pads they have hypertrophy and ptosis, whereas the deep fat pad have atrophy. And finally, their additive effect is seen on the skin as wrinkles and sagging of the skin.
Yes. So, moving on to the topic. So, Mrudal, can you explain how these facial fat pads are divided and how can we classify it?
Yes, definitely. Usually, there are two types of facial fat pads. One is superficial and one is deep, which is based on the location in respect to the smears. If they are present superficial to smears, they're known as superficial fat pads. If they are located deep to the smears, they're known as deep fat pads. In superficial fat pads, we usually have 12 fat pads, each in three in forehead compartment, three in periorbital region, three in cheek region, and three in the lower face region. Whereas there are usually four deep fat pads. The fat pads in the forehead, the deep, then the roof, SOOF, and finally the buccal fat pad.
Absolutely. So, before going to facial fat components, I just want to highlight about the ligaments which are present in the face.
Okay.
So, the function of the ligaments which are present is it gives support to other facial components like muscles, subcutaneous tissue also because it arises from the periosteum and it gets attached to the dermis. So, it holds the skin so that there won't be any sagging in the youthful people. Because of the laxity of these ligaments only, in older age, there will be a sagging present in the skin. So actually, we can divide the face into anterior and lateral face. When we draw a line vertically along the lateral orbital rim, we can actually divide the face into anterior face and also the lateral face. The significance of dividing this face into anterior and lateral is most of the muscles of facial expression are present in the anterior face. The point is, these ligaments and fat compartments which are present in the anterior face, which provides gliding for the muscles of the facial expression. In coming to the lateral face, most of the muscles are muscles of mastication like temporalis and masseter. So it is relatively immobile area. So this is the difference and the significance of dividing the face into anterior and lateral.
And there is also one more point regarding this division, the medial and the lateral division. The medial division, which is present in front of which is present anterior to the ligament, in that the layers of face are usually obliquely arranged.
Yeah.
So any procedure to be done for increasing the projection of the face, then we should address the medial side of the face. And the lateral side of the face, in that there is layers are in parallel arrangement. So if we want to increase the height of the face, then if any procedure has to be done for that, we should address the lateral aspect of the face.
Yeah. So today we are going to focus more on fat compartments present in the forehead region, periorbital region, and over the cheek region. Now, Mrudal, can you explain the fat compartments which is present in the forehead region?
Yeah, definitely. Usually, if you divide the forehead region, there are usually three septums: the superior frontal septum, the middle frontal septum, and the inferior frontal septum. So this is important to know because the forehead fat pads lie in this extent only. If we talk about superficial forehead fat pads, then they are in three in numbers and they lie extend from the superior till the inferior frontal septum. Then just below that there is a frontalis muscle and below that is the subfrontal fat pad. Subfrontal fat pad is very important to know because the supraorbital and supraorbital vessels are present in this plane only. And then in last there is the deep forehead fat pad which is present between the superior and the medial frontal septum and they are just present just above the periosteum.
Yes.
It is important to know about the forehead fat beds because the soft tissue fillers which we want to use for reversing the aging process, for that we should know the anatomy of this facial forehead fat beds. So Dr. Nishar, can you please elaborate or explain the details about the periorbital fat bed?
Yes. Coming to periorbital region, so periorbital region is very important because during the process of aging, most of the effects of aging are present in the periorbital region only. So coming to periorbital region per se, we can divide the fat present in the periorbital region into two kinds. That is, one over the periorbital region, that is called periorbital fat, and one over the orbital region, which is called orbital fat. So there are a lot of misunderstanding present between the periorbital fat and orbital fat. For example, the periorbital fat is divided into roof and soup, which is called retroorbicularis oculi fat and suborbicularis oculi fat. So most of them think that roof and soup are present over the eyelid, upper eyelid and lower eyelid respectively. But it is incorrect because the roof is present exactly beneath the eyebrow and soup is present below the orbital ring. So when we talk about the roof, the boundaries which are present, boundaries of the roof is it extends medially up to the supraorbital vessels and nerves. But when coming to the lateral part, it enters into the temporal region and it has its connection to the soup also. So before coming to know about the roof and soup, we should have a general idea about the layers of the eyelid also. Then only we can able to understand the importance of the roof. So eyelid can be divided into lamellas like anterior lamella and posterior lamella. So when coming to the layers from outer to inner, this is skin, orbicularis oculi muscle, tarsal plate and its associated attachment structures and conjunctiva. The layers of the eyelid, no, it will be different in different parts of the eyelid also. Like for example, in upper eyelid, in upper part the layers will be different. In lower part of the upper eyelid, it is different. In upper part of the upper eyelid, from outer to inner, it will be like skin, orbicularis oculi, and there comes the septum. That is orbital septum. Beneath the orbital septum, there comes the orbital fat. So this fat is misinterpreted with roof and soup. During the process of aging, the roof actually descends and comes in front of this orbital septum. Okay, so that's why we get hooding of bags present in the lateral orbital region. Moreover, this roof is encased strongly by the offshoots of the gallia apparentica. It has stronger attachment on the medial aspect compared to the lateral aspect of the eyebrow. That's why the descent of the ptosis and the fullness is present in the upper eyelid more on the lateral aspect compared to the medial aspect. When coming to the soup, that is suborbicularis oculi fat, it is, as I said previously, it is not located in the lower eyelid, which is located below the lower eyelid. So the boundaries are, it is encased in a compartment which is bounded superiorly by the orbicularis retaining ligament and inferiorly by the zygomatico-cutaneous ligament. This is the space which occupies this orbicularis oculi fat. So during the aging in the periorbital region, especially in the lower eyelid, we can able to see two bulges. One over the lower eyelid, which is caused by the prolapse of the orbital fat, and below the orbital region, we can able to see the descent of the suborbicularis oculi fat. And when we move on to the medial aspect of the lower eyelid region, there is no fat present in those regions. That region is called the tear or nasojugal groove. The layers of the face are different in different parts of the face, as I said previously. So in the medial aspect, there will be only skin, orbicularis oculi muscle, and there will be a periosteum. So these are the difference between the roof, soup, and orbital region. So the common misunderstanding about the periorbital fat components is they consider roof and soup which are present in the eyelid. So that is the incorrect misunderstanding.
Okay, thank you so much, Dr. Nishar, for such a great description. I just want to add one more point in this description, that the subfrontal fat bed and the roof are present in the same layer.
Yes, correct.
So I will be discussing about buccal fat bed anatomy.
Yeah, you should tell, because you can elaborate about the buccal fat pad. It's important because it is present. It actually covers the entire most of the regions of the face. So you can just elaborate on the buccal fat pad.
Yes, definitely. So it is important to know about buccal fat pad because the contouring of the cheek or the fullness of the cheek is because of the buccal fat pad only. So if we talk about buccal fat pad, it is present in the masticatory space and it is in close relation with the three important structures. One, the muscles of the mastication, parotid duct, and the nerves, facial nerve branches. And it is present between the anterior border of the masseter muscle and the lateral border of the buccinator muscle, and it is usually present deep to the buccinator muscle. Usually it have a main body is there of buccal fat pad, and there are four extension of buccal fat pad. That is the pterygoid extension, pterygobladder extension, temporal extension, and buccal extension. Of this, the buccal extension is the main important part of the buccal fat pad because it is only the part which provides the fullness and the contours the cheek. And there are usually three lobes in buccal fat pad. It is anterior, posterior, and intermediate. So the buccal extension comes under anterior lobe. The pterygobladder extension come under the posterior lobe, and the temporal and pterygoid lobe comes under the intermediate lobe. If we talk about the main body of the buccal fat pad, it lies above the parotid duct, whereas the buccal extension lies below the parotid duct and it is deep to the parotid duct. And these both together constitute around 60 to 70% of the weight of the buccal fat. Then if we come to the parotid extension, it is known as pterygoid extension because it is in close relation with the pterygoid muscles. If we see, it extends in the over the medial border of the ramus of the mandible and it finally rests on the pterygoid muscle. Then about a temporal extension, it extends superiorly and it passes beneath the zygomatic arch to finally reach above the zygomatic arch. Above the zygomatic arch, it rests on the lateral orbital rim and finally it rests on the greater wing of sphenoid. So if we see such a great extension of the buccal fat pad, I think it is like a misnomer to tell it a name is a buccal fat pad because it is in a close relation with the muscles of mastication with zygomatic arch and with the parotid duct. So its proper name is masticatory fat pad.
So why do you think this buccal fat pad is important, and any cosmetic difference which makes in younger group or in a older group?
Yes, definitely. The buccal fat pad is anatomy is important to note because of 2 points. First, it is in close relation with the muscles of mastication, parotid duct, and the facial nerve. So therefore, its surgery is very important to avoid the atogenic injuries to all these structures. And second, nowadays there is a trend in youngsters to have a depressed or hollow cheeks. For that, the buccal fat pad surgery is done, which is done by an intraoral approach.
Okay, you just elaborated well on this buccal fat pad.
Thank you.
So that's the end of our discussion today. So to conclude, the aging is a continuous process which cannot be reverted or stopped. Only it can be camouflaged. So for that, we have to understand the layers present in the face. Not only the skin, which has its effect, which has the aging has its effect on all layers of the face. So today we have highlighted few points about the facial fat components, and especially on the forehead, periorbital region, and the buccal fat pad region.
And we should know about facial fat pad because we want to augment the by using the soft tissue fillers. So for that, anatomy is very, very important.
Yes, absolutely. So in forthcoming weeks, we will discuss on some other topics also. And pleasure to meet you again. Thank you.